curious, Jeff, as we look towards more hospitals, clinics utilizing locums to fill that gap or to meet the needs of their patients, what do you think differentiates staff care in their eyes, the value that we bring to the table?
I think one of the things, Bonnie, that you got to remember about staff care is we're not new to this industry. Staff care has grown with this industry over the last 20 years, and so there's not much that we haven't been exposed to in terms of the way that we can partner with hospitals. I mean, we just talked about the fact that to view us as a true partner in and of itself is something that's an opportunity, I think, within healthcare where we can help meet a need where, for example, you might have a hospital that sees some seasonality in terms of what their census looks like over the summer. And it might not make the best economic sense for them to employ a doctor full-time where they could supplement their staff during busier times with a locum tenens without having to experience the burden of bringing on somebody full-time. There's a lot of inherent flexibility with temporary staff that aligns nicely with the goals that hospitals and then smaller clinics and group practices experience on a day-to-day, week-to-week basis.
I'm curious, Kristen, if you have run across clients that have also used locums because they do not have a good feeling for census fluctuation. It's a little bit all over the board, and bringing in a physician to staff full-time is sometimes a little cumbersome. If they can bring locums in, then they have the ability to release that physician from an assignment. Have you also run across that?
I think that is a major change over the last maybe 2 to 3 years, and I anticipate that it will continue, is, the previous theory was 100% full staff. We're doing well if we are 100% fully permanently staffed. And with the economy and the changes in volumes and patient base and census, much less some of the healthcare reforms that everyone is just waiting to see what changes that might bring, like reimbursement changes or government regulation. That is where we're seeing some of the more innovative healthcare systems and practices move more towards a 90-10 or maybe even an 80-20 model. If we can be 80% fully staffed with permanent clinicians and utilize a flexible pool of 1099 physicians that then we can rotate in and out as needed. I've got the solutions there to ebb and flow to meet the whatever conditions come about throughout the year. And it's heartbreaking to see maybe the smaller group practices who have hired too heavy and now they can't pay for themselves or their overhead because they've just got too many people sitting around without enough to do. Mm-hmm. So that's an area I truly feel like staff care and locum tenens is able to meet a critical need, again, particularly since many clinicians are not sure what's going to happen here in the next 3 to 5 years.
I think it's very interesting that many of our clients do not have a firm grasp on what that appropriate level is. And I know that staff care is able to provide consulting services that really deep dive into a physician's practice or into a client hospital setting to look at exactly what what the right number of temporary FTE hours is as compared to permanent. And also with our MSP offering, managed services, we are able to provide to hospitals a very clear visibility across their organization into all of their spend, helping them make sure that they're rationalizing where they are spending, making sure that it's the most efficient use of the dollars that they have budgeted for temporary staffing as well as take care of all of the additional vendors that they're using, because our clients oftentimes use multiple locums agencies to help fill their needs, and we're able then to take on that responsibility for them. I know that's very appealing to hospitals as well.
Yeah, there's a real opportunity, I think, with certain clients where you've got administrators where the staffing component is kind of an add-on in terms of what their core responsibilities are. And depending upon what facility you're working with, I mean, there's times where that add-on could be a main driver in terms of how they spend their day. And what a great opportunity for a client to be able to take that, use an existing vendor like Staff Care and AMN, and outsource that component of their day to an expert in that field, which then allows them to apply all of their time and energy into what their true core competencies are, which is helping their facility run smoother and more efficiently, which in turn will provide better patient care and a better outcome.